Pittsburgh families, SNAP benefits are a lifeline, helping to stretch grocery budgets and make healthier choices.
With new cuts to the program, what's the real cost to our health? Dr. Natalie Gentile joins us this Wellness Wednesday to break some of this down. You know, for some people who are not familiar with SNAP, what is it? And talk a little bit about who it serves.
So, Supplemental Nutrition Assistance Program, formerly called food stamps. This is for low-income families. A lot of times we're talking about children, people with disabilities, elderly populations that are relying on this supplemental assistance to get food in their homes on a day-to-day basis.
Yeah, this is how they're eating every day.
Yeah, food. We need food.
Yes.
We need to eat.
Yes.
Right. So with these new cuts, tightened eligibility rules as well, many families could lose their benefits altogether. Can you talk a little bit from a medical perspective on what kind of health effects this can have overall?
Sure. So if we first start with hunger at a baseline, and think about kiddos, for example, we're going to have poor concentration and attention in school when kids aren't having access to food on a consistent basis at home. When I think as a physician about the implications of poor food access and food insecurity on somebody's health, you might be choosing between food and your medications. You might be choosing between food access and going to a doctor's appointment. And these have repercussions down the line.
Right.
This means that people aren't going to have great adherence with their medications. If you have diabetes, high blood pressure, that's a game changer for you. Right. If you're not consistently, adhering to the medication regimen or seeking medical care. But that is the reality that people will be choosing between eating and actually seeking health care and taking care of their own bodies. And also the food that they have access to, if it's less than they normally do, right? Or if they're finding things that are more calorically dense but not nutrient dense, then they're also not going to have great health either. High sodium foods, right? Ultra processed foods that are affecting their health poorly.
I think fast food immediately, for sure. And so I'm thinking that this is not just affecting people from a physical perspective in terms of like some of the disease outcomes, but also like, mentally, just not having enough food. Like kids can't perform in school, adults can't perform at their job, and it just has so many widespread ramifications.
Mental health effects are going to be great at this point, right? I mean, people are going to have significant levels of stress. And add to that we are in a current climate where people are really struggling in what kind of health insurance they're going to have access to next year if they can afford it. So now it's a question of affording health access, period, on top of that food insecurity. And I think we're going to have a highly stressed population with some serious consequences down the line.
I don't want to talk about the ripple, because there is kind of this ripple effect. You may not think that I'm not hungry right now, this doesn't affect me, but there is a ripple that could come.
Certainly, you've got higher utilization of healthcare resources like emergency departments and urgent cares. If you walk into an emergency department, we have to treat you whether you are insured or not, whether you have the money to pay for it or not. That type of cost greatly affects everybody, regardless of if you have Medicaid, regardless of if you have great insurance or are uninsured. We all are affected by that. Well, if people are struggling with food insecurity, that is going to affect their health, which is going to lead to poor utilization of resources in the healthcare system.
Right.
These ripple effects are great. They are very real, and I don't think people are seeing the long-term picture here.
I mean, the healthcare workers are going to be overwhelmed.
We already are.
By patients,
Yes.
Absolutely. And so you're seeing patients every single day. What are you hearing from them? How is this affecting them?
People are scared, right? They're worried about what they're choosing to spend their money on and have access to, and they're worried about their friends and their community as well. My patients may not be all of them struggling with food insecurity. They're worried about their neighbors, right? They're worried about their family members, and so this is a bigger community issue.
Well, I'm glad you brought that up too, because I think that there are some people who say, like, what can I do to help? We just talked about this family locally who set up a food pantry in their front yard. They're doing some things to try and help and do anything. What can people do?
Certainly. So I think donating money to food banks can be helpful so that they can allocate those resources and that money appropriately for their community's needs. Donating food, of course, to food banks and local food pantries, absolutely. We have a box at our office, for example, where it's just a take what you need, leave what you don't need, no questions asked. I mean, so because even if it's not my patient who needs it, they might know a friend. And I think another important thing is not everybody can make it to food pantries during their work day. And so if you know someone who's struggling, you're able to go and pick up something for for them and help them, I think that goes a long way. And it's something, honestly, I didn't realize until someone brought that to my attention.
Interesting. Oh, really important conversation.
Yes, thanks for breaking down the big picture for us. Yeah. Well, if you're interested in learning more about Direct Care Physicians of Pittsburgh or Rebel Wellness, head to our website, kdka.com/talkpittsburgh.
And local nonprofit 412 Food Rescue is stepping in as well. We wanted to pass along this valuable resource. They take surplus food and deliver it to local communities that are in need. If you are a local business who would like to participate by donating excess food, or if you could benefit from assistance, we're going to have the information that you need at kdka.com/talkpittsburgh.
Well, this is a good time to remind you about the KDKA TV Turkey Fund. You can help your neighbors this year by donating now. Now, all proceeds, local families put food on the table this holiday season.
And there are many ways to donate. You can stop by any PNC Bank branch. They're going to match donations of $50 or more. You can also text KD Turkey to 50155, or you can go to kdka.com/turkeyfund right now to make your donation.
All right, well, coming up, feel connected to your community at one of Pittsburgh's longest running events. This year, Veterans Day Parade, Grant Marshall is sharing his incredible story of healing and patriotism. Be sure to add some inspiration to your day.